After having shared that we are finally online with Artema Academy, I would like to give you a bit more detail about the course. The first course that is called Orientation on Clinical Development of Vaccines. What exactly will you learn in our new course? So here's a concise overview, each designed to give you a structured, regulator-ready understanding of how vaccines move from concept to clinic. First, we start with the understanding of history of vaccines and history of clinical development. Yes, there is a very long-standing history existing where people stood on shoulders of giants so that they could see further, and we are standing on their shoulders today so that we can see further even. It is important to understand this and to see how one information builds on the other and how science is building up on each other. Then there is a lecture about vaccines overview. It underlines mainly how vaccines work. It shows proof that vaccines do work very well even, including what you would have heard in the vaccines history talk about smallpox, the first disease ever eradicated from this planet by the use of vaccines. We will then go into the immunology and the mechanisms of actions that are understood as of today. This is an ever-evolving field. We do not know everything, but we know already some bits and pieces about the immunology and vaccines. And although immunology is a complex topic, it is not complicated. You will see this in the course. We will talk about a global pipeline of vaccines, where innovation is happening today. Then there will be a lecture about the clinical development plan, how to set it up, the strategy behind moving vaccine candidates from phase 1 to licensure into life cycle management. Then it will be broken down into units of these clinical development plans that are the clinical development trials. There will be some key elements of trial design that will be detailed here. We talk about endpoints, safety assessments, and operational considerations, but also biases and a little bit of statistics. We talk about correlates of protection. Why are they important? What are they? What are they not? I can tell you so much, they're not thresholds. The next point is maternal immunization, very important vaccine-specific topic. And it also teaches here very specifically why one team failed and the other team succeeded in building up maternal immunization plan and trial. We will talk also about mindset and leadership. It is absolutely essential that we have a clinical development mindset and a leadership that affects ourselves, but also entire teams while moving forward in such complexity. And last but not least, we will learn about the impact of vaccines on antimicrobial resistance. A very important topic that every vaccines developer needs to understand before moving forward with the next vaccine candidate. This course gives you the structure, vocabulary, and strategic understanding needed to navigate vaccines development with confidence. Whether you're a founder, clinical scientist, or part of the biotech team, you will benefit from this course and conduct clinical trials in the vaccines clinical development with much more confidence based on this knowledge. Our launch offer is valid until 26th of June 2026. After that, the regular price will move to 2,497 Swiss francs. Available now at Artama Academy. Check us out there and have a wonderful time. This is Frederick Wittke, co-founder of Artama Academy, Clinical Development Science Made Easy.